Hi, my name is Annie Evans, and I'm the Director of Preparedness and Disability Integration at ASTHO. Today I'm interviewing Susan Tharpe to learn more about partnering with the autism community for disability integration in emergency preparedness. Susan, would you like to introduce yourself?
Sure, Annie. Thank you. Hello, everyone. My name is Susan Tharpe. I am the Disability and Preparedness Specialist for the beautiful state of Georgia. I actually work with the Department for Public Health, and my position is funded through ASTHO. And so I'm basically working with the Emergency and Preparedness Department under the FEP and HPP department. And so I am very grateful to be here. Thank you so much.
Thanks for being here. So let's get into a few questions. Why is it important to form partnerships with the autism community in emergency preparedness planning?
It's important because, people that identify as being on the spectrum, it's a very large group. And what a lot of people don't know is that each person is different. It affects each person differently. So it's important because there are many different needs that you need to anticipate or plan for when you're talking about sheltering and evacuating people during an emergency. So it's very important to have the autism perspective when it comes to emergency planning.
So, what are the barriers people living with disabilities, specifically those with autism, face when it comes to inclusivity and emergency preparedness?
One of the things is, you wouldn't really think about it, but food. A lot of times, people with autism have, different types of diets. And so, just when it comes to planning a shelter or anything like that, you have to remember different food, different diets. Also, access to information, access to appropriate mental health as well as behavioral health um, services. When you're sheltering, when you're doing some planning, one of the things that we know, and I have a son that has autism as well, is that any change in the regular routine sometimes brings about behaviors. And so when you're thinking about sheltering and evacuating or emergency plans for any type of disaster, those are things that you have to factor in. And I think because of the pandemic, a lot of the services have been put on hold. And so it's very important to have those be included in your planning and your emergency preparedness.
Why is it important to form partnerships with the autism community in emergency preparedness planning?
I think it's very important to form those partnerships because for a lot of disability communities, there's a trust issue. And for those of us who really don't have a disability, it's kind of hard for us to understand. But people form relationships with people that they know have their best interests at heart. And if you're someone who is trying to forge a relationship and you have no knowledge of the challenges, of the barriers, of the issues, it's very hard to take you seriously. So, for people, is particularly with autism, it's very important because that's a very strong group that actually is very involved in the advocating, and they're very knowledgeable about the services. And so it's very important to make that connection and be involved in the community. Go to some of the events. Participate in some of the conversations in regards to that. Let them know that you truly are that you truly are interested in the community.
How has Georgia partnered with the autism community to promote disability inclusion and emergency preparedness?
Georgia has an emergency coalition, and they have brought a lot of the disability organizations to the forefront. And that emergency coalition is working to include people with disabilities in the planning, exercise, and training of emergencies. And what Georgia has done is we brought the autism community along, but with my position, because I am a trusted member in within the community, I've been able to reach out to the really big groups and have them come along as well and join us. So I'm bringing more partners to the table. I feel like it's very important to have different perspectives. Some autism groups are more research based, and some are more consumer based. And so I think it's very important when you're talking about a disability to bring the different perspectives to the table. So Georgia has opened their arms and they are allowing me to invite whoever I want. And I'm reaching out to all the groups, as well as the developmental and disability organizations, to bring everybody, as many people as possible, to the table so that we can have a well-rounded discussion.
What challenges have stakeholders faced in building up the partnerships between Georgia and the autism community, and how were those challenges addressed?
I think right now it's that trust, the trust and just a general knowledge of what that disability is. And as I know, and I'm sure a lot of people know, autism is just a general diagnosis, but there are several other diagnoses that go along. For example, my son has he has OCD, he has Tourette's, he has intellectual delays, and so I think the challenges have been not really fully understanding what the diagnosis is and how it looks different on different people.
What has Georgia been able to achieve once stronger partnerships were in place with the autism community?
So I think Georgia's learning that the disability community is open, particularly the autism community is open. They want to be involved. All the organizations that I've spoken with really have expressed an interest in being involved with the Department for Public Health. And so I think with my position, I am putting Georgia in a position where those people are coming to the table and they're willing to share about autism, and they're willing to educate. And that's the important thing here, is educating. No one really understands unless you educate them. And so they're willing to do that.
Are there special considerations for engaging the autism community on emergency preparedness?
I think it goes back again, they're very educated, they're very involved. And I think when you're talking about including people with autism in emergency preparedness, one of the key things you need to do really is those caregivers and those parents need to be invited as well. They bring a unique perspective. They can offer you a lot of information, a lot of education. And so that would be one of the key things to factor in.
What are your recommendations for other jurisdictions looking to initiate partnerships with the autism community?
I think it's very important to understand the diagnosis and how it looks differently on each person. I think, understanding education, I think, inviting those people to the table with an open mind. And there are several centers for independent living that offer simulations. It's just a simulation of what it's like to have autism. And that is very important because there are so many levels. There's so many levels to that disability, and it's very important for people to understand that.
Is there anything else that you'd like to comment on or say about building partnerships with the autism community in regards to emergency preparedness?
I think it's critical for there to be a representative from the autism community when planning for a response to an emergency or disaster. This community has many needs that should be considered and incorporated into an emergency plan. Planning is key for people with autism. Change is something that is very difficult for this community. And so anytime you can incorporate some type of planning, it would be great for those families. For many people, the routine is just a critical part of their day. And so if you can incorporate those plans into people's lives, it'll be a little bit easier when and if a disaster happens.
Thanks for joining us to learn more about partnerships with the autism community. And thank you, Susan, for sharing today.